Hello and welcome to an overview of the Experian's eCare Next suite. We will be implementing eCare Next as a front-end solution for Northwell Health physician partners. eCare Next will automate manual patient access processes as well as repetitive tasks in the front end to reduce manual work and denials. The exception-based technology, which we will discuss in this presentation, identifies and presents only those patients who will need follow-up by your staff in order to be financially secured prior to their arrival. Soarian and Experian Solution Overview. eCare Next features the ability to fully integrate with Soarian. This section will show you how the integration works and how it will look in our system upon implementation. The Next bar. eCare Next consists of a toolbar that sits on top of the Soarian platform. Using an alert system, staff will be aware of any issues with the account as they go through their current workflow at scheduling, check-in, and appointment management. Patient alerts. Each button on the Next bar represents a category or function. Any button in red indicates that a potential error or alert has been triggered in that area. Any button in green indicates that no errors were found. To view the detail behind any alert, simply click on the red button to get more information. Real-time work lists. Unlike our previous financial clearance application, OnTrack, eCare Next work lists are real-time. There are no imports or scheduled downtime which interrupt the front-end workflow. The exception-based alert system allows users to easily identify and address problems with the account prior to the patient's visit. Experian's relationship with Cerner allows for a seamless integration between both products. New functionalities such as premium eligibility and address checker, which we will discuss in more detail, are built directly into the Soarian platform. Other functions like patient estimator and passport authorizations have automatic postback to update Soarian encounters as needed. Now that we have a foundation of what eCare Next is and how it works, let's watch a demo to see how the tool will enhance our front-end workflows. Here we see an eCare Next work list. Patient name displays on the left, while alerts display on the right. Today, we will focus on coverage alerts, or CV. Click the patient name hyperlink, the account summary displays. Click alerts to see the detail for each alert. Expand the coverage alert section. For this encounter, there is an issue with the subscriber information. The protocol tells us to review the subscriber information in Soarian. Copy the encounter number. Toggle to Soarian, click Revise Encounter Details, paste the encounter number into the identifier field, and click Search. Select the encounter and then select the Patient Insurance tab. For this health plan, the subscriber is set to self. Let's see if the full HDX response tells us otherwise. We see the subscriber should be set to the spouse. Now we can fix the error by adding the spouse as the subscriber. We can now click Done and return to eCare Next. The alert is cleared once we refresh our work list. This completes our eCare Next work list demo. eCare Next impact to physician partners will be seen immediately. Implementation is a part of the North Star project. The real-time platform provides a single integrated solution that is continuously updated with patient information from Soarian. This will allow our teams to work more efficiently and help to prevent errors during registration and at the front desk. We anticipate increased collections, enhanced patient satisfaction, better tools to prevent fraud, limit the collection of incorrect demographic information, and other errors that cause denials. The eCare Next solution package consists of several products. Premium eligibility. Today we use HDX, but Experian builds on top of our existing HDX platform to embellish or enhance our eligibility response to come back with additional information through their premium eligibility. This includes accurate copay information, additional PCP information that was previously only available on payer websites, total remaining deductible, and neatly organized payer response information. Finally, we will have access to additional payers. Let's take a closer look at premium eligibility. Here we can see a Medicare coverage response with Experian's premium eligibility. Premium eligibility's normalized view puts the response data in the same place every time, regardless of which payer the response is from. The normalized view can also be customized based on location. So if there is a specialist and they need specific benefit information, it can be placed right on top in the normalized view. The two tabs up top show that it was originally registered as a Medicare patient. We receive the Medicare response and it shows active. However, in this case, the patient has a third-party liability or TPL plan from Blue Cross Blue Shield. We can see where the response very clearly says third-party payer and identifies the payer. Experian will automatically send a response to Blue Cross Blue Shield to give us the correct information. Let's review the Blue Cross Blue Shield response. We can toggle from the customized My Response view to the full response view in order to see all coverage response details. We can see here all of the same information from our HDX response, but in the neatly organized, normalized view. The coverage details are easy to read. Let's quickly compare how our current HDX response will display the third-party liability or TPL plan today. We view the full response. We can see the TPL indicator is set to yes, but no other information displays. We must toggle to the Other Benefits tab. Locate and select the Other or Additional Payer field before we can see that Blue Cross Blue Shield is identified as the primary payer in the Related Entity Information box. This concludes our premium eligibility demo. Coverage Discovery. Coverage Discovery helps reduce misclassified self-pay accounts by finding active coverage for Medicaid, Medicare, and commercial insurance. This will reduce self-pay write-offs as well as denials caused by data entry mistakes. Coverage Discovery also reviews a patient's demographics for an increased likelihood of finding and correcting coverage. Their confidence scoring tool will reduce the potential number of false positives. Registration Quality Alerts. eCare Next creates registration quality alerts, or RQAs, to limit downstream errors. These early detections of registration inaccuracies create alerts in real time. Experian provides a best practice starter set of alerts, but they can also be customized to meet our specific needs. We will utilize these alerts to create work lists, manage front-end workflows, and create an audit trail of user activity. Patient Estimates. This user-friendly tool allows patient payment estimates to be generated by utilizing information from the Charge Description Master, CDM, payer contracts, claims data, and eligibility response data such as copay, deductible, and coinsurance. Multiple search options and customized templates make it easy for users to find the right procedure, while easy-to-read estimate breakdowns allow practice staff and patients to understand how the estimate was calculated. This provides increased price transparency, improved collections, and higher patient satisfaction. The estimate is delivered into Soarian through Experian's automated post-back functionality. Now let's build a patient estimate together. To begin, click Launch. We can search for the CPT code. If the actual CPT is unknown, we can use the Charge Master search function. Simply enter a search term related to the procedure, like head. Any CPT with the word head in the description will display. If the actual CPT is known, we can use the Charge Master search specific function. For frequently used procedures, templates can be built. Here, we see a collection of all CTs with contrast. Finally, We can utilize a claim search. Any past claim can be used as a template to build our new estimate. We can also review and edit as needed. Click Select, and then click I'm done. We can view the full estimate results to see how the patient responsibility is determined with the help of premium eligibility. We are also provided with a customizable representative script that can be read as part of the front-end workflow. We can click Print to provide the patient a copy of the estimate. This concludes the patient estimates demo. Passport authorizations. Passport facilitates the submission of prior authorization and electronically monitors the process until a final status of approved or denied is received. Inquiries are automated and take place behind the scenes without user intervention, while submissions guide the user through the workflow, autofilling all of the information that Passport has received and prompting the user only if their intervention is required. The status and authorization number are automatically posted into Soarian. Passport also has a special database called the Payer Knowledge Base, which identifies when an authorization is needed on an account. Northwell has already implemented Passport authorizations and continues to support the practices to optimize this feature even further. Patient financial clearance identifies patients who meet financial assistance qualifications for Medicaid, charity programs, and other government assistance, matching them to the most appropriate workflow and automating the enrollment process. Using red flag alerts, the financial clearance function also alerts our users to check patient demographic information. The new address verification function not only makes sure we have the most up-to-date patient address, it also ensures the information in Soarian is a U.S. Postal Service verified address. This helps to reduce bad mail, decrease denials, and reduces our fraud risk. Patient financial clearance also looks at a patient's propensity to pay and offers us the ability to create realistic payment plans to ensure patients can afford their payment plans. Let's see how the embedded address verification workflow can reduce some registration errors. To begin the check-in workflow, we can see this encounter has an alert for demographics or DG. Let's click the DG button to see the alert details. The account summary informs us the patient's address has not been verified. We can now toggle back to Soarian and send out an address verification request. On the Patient's Demographic tab, click Request. Let's choose Address Checker for the request type and click Submit. We can continue with check-in while we wait for the response. Once the response is received, click Response. The left column displays the response information. The center column displays the information currently in Soarian. And the right column displays any alerts, actions, or messages that may be potential red flags. Any discrepancies will be identified with a red exclamation mark. We can see the address in Soarian does not match the address in the response. To accept this discrepancy, we value Update and Response Reviewed and click OK. The correct address now displays in Soarian. This concludes our address verification demo. We look forward to implementing this exciting front-end solution and working with your service lines to optimize the user experience.